Good evening. The nationwide lockdown that was to end on Tuesday is now going to be extended by another 2 weeks, but with some exemptions and some changes. The 21-day nationwide total lockdown that was ordered for by Prime Minister Modi last month, which has seen all commercial establishments and shops shut down, except those selling groceries, vegetables and medicines, has hit the economy hard. And the extended lockdown will have suggested specific measures for agriculture and allied sectors, including a modification of laws to facilitate the sale of farm produce, to help vegetables and other essentials reach end consumers quicker and basically ensure that people stay indoors. Now, the decision to extend the lockdown has also come on a day when the number of coronavirus cases in India and the death toll to the virus have spiked. The highly infectious COVID-19 has killed 239 people in the country, with 40 new deaths reported in the last 24 hours. The total number of positive coronavirus cases now stands at 7,447. Remember, India's COVID-19 cases have been rising throughout the lockdown, even though the lockdown was declared relatively early. Why is that? Is that because the lockdown has been ineffective? Is that because it wasn't enforced or followed by all? Because for the last 16 days, India has been under, or should have been under, a nationwide lockdown with minimal interaction, even with, for many of us, loved ones, for parents, all of this to flatten the curve. Or is it because, as many point out, India is testing at very low levels? Well, today we have on the show two COVID-19 suspected patients who say there are lapses in the system at a time where we cannot afford lapses. They're here to talk about their experience as they awaited their test results, because they want to try and create awareness about what we're up against and try and ensure that what they endured does not happen to anyone else if possible. We're calling the show My Coronavirus Story. And first to tell his story, joining us is Prateek Sengupta. He's a resident of the National Capital who says that he was made to run from pillar to post for treatment. Prateek, first and foremost, you tweeted a video where you said when you were in an isolation ward while you were awaiting a test or test results, when you were suspected of having COVID-19, of having coronavirus, you tweeted saying, "Please help me, or my next post will be my suicide video." Why? What's your story?
I apologize in advance because I'm taking short, heavy gaseous breath. I'm a suspected patient. When I was admitted in the hospital with this shortness of breath, I was forced to sleep in a cubicle with 5 other men who were also suspects. And not to name them, but most of them were having some kind of symptoms, and one of them was having a lot, like heavy, intense coughing, and they were not using masks in the same cubicle. And be it my COVID, be it my anxiety, my panic attack increased so much that I was so much out of breath, and there was nobody to even listen to me. And I had to do that. I had to share that.
That's why you said, in fact, you said that I will die of anxiety before I die of COVID-19. You tweeted, "I need to get out of here at a safe place. This is insanely not sanitary. I don't want to create an elite versus the poor syndrome here, but dying of nonsense is not acceptable." Those are very strong words, Prateek, at a time when we're facing, a huge crisis, where we know that we may not have the infrastructure, where we may not have the resources to take this on. And that's really why we've had to enforce a nationwide lockdown, because we know that the death toll when it comes to coronavirus or COVID-19 isn't that high. But the fact is, it could just overwhelm the system. But what did you mean when you wrote these words? Dying of nonsense is not acceptable.
When I reached the isolation ward, the so-called 6th floor of the hospital, which is now the isolation ward for COVID, I came to know that there are 100 other patients in the same floor, out of which 22 are positive confirmed cases. And then I came to know that there is a single bathroom. That's not even a bathroom. It's a facility with some 8 lavatories some 20 urinals and open taps where all the people are bathing, showering, washing clothes and doing everything together at the same time. And when you are there as a suspect and when you know that the contagiousness of this virus is so intense, then how can you allow 22 positive patients to use the same bathroom with other suspects?
Okay, so you're saying there's some basic glaring lapses that one should be able to correct if we want to actually fight the coronavirus, if we want to make sure that we flatten the curve and if we want to make sure that we don't create more persons with coronavirus. But you know, Prateek, many might say this is just anecdotal evidence that we're putting out on the show. Why do you think it's important that we highlight your story? Why should we put you on a show like this today? You also talked about, I think you mentioned how when you were out of breath that you were constantly turned away from hospitals.
Yeah. So the very first day when I suddenly had this shortness of breath, I ran to the private hospitals. I ran to one hospital. They said that we are not accepting any such patients. You can use. They showed me a list of some hospitals where you can go. Then I reached another hospital, the private hospital. They also shut the door on my face. Then they showed me another list that there is an amendment in the list. There are new hospitals you can go to. Then I went to third private hospital. They also shut the door on my face. I ended up at the government facility in North Delhi, and there they took a swab and then they sent me back home. I was back home with again shortness of breath, and I ran back again to the government facility, and I waited there for at least 45 minutes to 1 hour lying on the road with shortness of breath, asking them to shift me or give me some emergency treatment, and they were not ready to give it. They were like, you will have to go to LMH or GB Pant or Rajiv Gandhi Super Speciality.
So, I also want to check, at one point you drove to the hospital yourself on a scooter while you had shortness of breath.
Exactly.
And so at another point, you made your wife, or you didn't have a choice really, you made your wife, you exposed your wife. If in case you are positive, you actually exposed another person, another Indian, to the coronavirus, because she then had to drive you to the hospital because there was no ambulance to come and pick you up with authorities who would be in the proper PPE suits.
Exactly, Farah. So what happened was, what is happening right now is the only ambulance service which is working for COVID patients is the helpline number 102. We kept calling on 102 for half an hour. It was busy. Then we ran to the hospital. There was an ambulance standing right there. But the driver said, I can only take you guys to the assigned facility when I get an order from the 102 helpline headquarters. After half an hour or 40 minutes, they allowed, and then we were about to go into the ambulance, and I was ready to go, but then I realized there are 4 other suspected patients who are coming in the same ambulance with us. So I refused for that. I asked my wife to take the scooter back to my home. Then I took my car and I drove myself to LNH. And then there also I was made to wait around 2 hours to get to the bed. The lift elevator was not working. There is paperwork they are doing before admitting. Then if a person is out of breath, you have to give them some kind of, they kept on saying that you are getting an anxiety attack, your saturation level is okay, so you don't need to get in. I'm still out of breath. And this is after I am discharged. So there was no treatment.
But Prateek, we must, in full disclosure, as you pointed out to me, you are a smoker.
Yeah, I am.
And you haven't hidden that. You're only 28. So you're 28, you've been showing these symptoms, but full disclosure, you have been a smoker, and you are trying to stop that now, though, you're saying.
Yeah, so I will be really honest. When I got the first attack, till that shortness of breath, till that first attack, I was still smoking. I will be really honest about that. But after the first attack, I stopped it, and now it's been 7 days I'm on cold turkey. And because I don't know, because I have done that before earlier as well. I have stopped smoking for 7 days, 1 month, but I was never short of breath or anything like that. These were not the withdrawal symptoms I used to have earlier when I used to stop smoking. But
Got
now
it.
we
Okay.
are having.
So, Prateek, stay on the line because I also have documentary filmmaker Akansha Sood joining us. She was quarantined in a makeshift facility at the Gautam Buddha Nagar, and she is raising questions about the dismal hygiene standards maintained at this facility. Akansha and Prateek have been allowed to go home, but Akansha, you say that you were exposed more to infections than, I mean, you're probably more at risk now than you were before. Why do you say that?
I actually responded to a contact tracing call that came because I'd taken a flight 12 days before. Sorry, I can hear my voice again and again. I responded to that and I called up on the helpline. It was from Chennai. Because I don't live there, they told me to get in touch with the local authorities, and I did. I told them that
12 days after you took the flight. So you had,
yes.
And in these 12 days, because you need 14 days of quarantine, were you showing symptoms?
No.
In those 12 days?
No, I had a wet cough, but that was because of a pollen allergy. In the 12 days, I had seen my ENT doctor 3 times and everything was fine. I was staying with my husband.
Okay, so first lapse, 12-day gap between your flight and them calling you and asking you to come and get yourself checked up. Okay, sorry, carry on.
So when I spoke to the authorities locally, they told me that I should get a test done, and for which I would be quarantined for 2 days because the report takes 2 days to come.
Yeah.
I was perfectly fine. I was told to report to a hospital, which I did. My swab was taken. And then I was told to get into an ambulance. And at that time, I thought I was being taken around to another side of the hospital because it was a very, very big hospital. And obviously, they didn't want suspects to, roam around. But this ambulance leaves with 2 people with me who are coughing, and one guy didn't even have a mask on. And we were taken to a facility about 4 kilometers away. It's a makeshift, it's a hostel converted into a makeshift quarantine facility. And you go in there and you said, okay, we'll give you a room. And luckily, everyone has one room to themselves, which is,
unlike Prateek's
which is
case.
very good. Yes, unlike Prateek's case.
So what's the problem?
The problem is the hygiene level. No one expects a 5-star treatment, but we expect basic hygiene. There are common areas which people are using, which is the toilets. Men and women are using the same toilets. They haven't been cleaned. People are using the bathing areas to poop and pee because the toilets are dirty. Water supply is not good. There's water in the sinks, but not in the taps or in the flush tanks.
Okay, so look, this is a point that Prateek has already made. You're saying the lapse here is that it is no use putting somebody in an isolated room alone when they have to use public bathrooms or they have to eat together with everybody else. That's counterproductive. It defeats the purpose. Is that what you're saying?
It defeats, that is. And the other big thing is the test reports are taking too long to come.
Yeah. So you were to be there for 2 days. How many days have you been there?
I was there for 5 in total.
Why did the test results not come in? Why do you think the test results didn't come in?
I don't have answers to this because nobody has been able to give me the answers. All I know is that probably there is a delay. There's pressure on the testing labs. More swabs are being sent to labs for testing, but the instruments probably have not, the number of instruments being used have not increased. So there is pressure. But if I look at my, the list that came out, my report came out on the 9th. And here we are on 10th afternoon, and I am appealing to people in public, can someone help me find where my report is? And as per that list,
and
my
all
result
this time,
was out on 9th.
You're saying you were exposing yourself. So every extra day that you were to spend there, you were exposing yourself to others who may have COVID-19.
Yes, and I know that yesterday the number of results that came out of them, one person in the same facility tested positive. I know who that person is, and I know that I was sharing the same bathroom with her.
So your test result, you were there 5 days. Prateek, how long did it take for your test results to come in?
Luckily, because of some calls and the tantrums I did at the hospital, they gave me the result after 50 to 55 hours.
But still not 48 hours. And you, of course, tweeted everybody in the Aam Aadmi Party government.
Yeah, exactly. They were not ready to show me those results. I did the tantrum and the results were in front of me.
Okay, but I want to ask, both of you are now back home, but neither of you have had a second test. Do you not need to be tested twice to actually know if you are positive or negative?
My second test is scheduled on Monday because I'm still having symptoms. I am still out of breath and having a little bit of panting every now and then. So I want to get tested, and then I ran back again. The moment I got discharged from the hospital, Loknayak, I ran to Max, and they also said that for getting into, any other treatment, you will have to have 2 negative reports. So that means I'll have to go again back to the facility, stay there or whatever it is, and then get a report after 2 days. Then I will get a treatment. If I'm having a bronchial cancer right now or a tumor in my body, I cannot get treated for that.
As we saw those horrific, heartbreaking visuals of that 3-year-old child who died in Bihar, being carried around in his mother's arms because he was not being treated because everybody is focusing on coronavirus. That is the main risk of the outbreak. It isn't that everybody is going to fall sick and die. It's that so many people can get sick so quickly that our health services and infrastructure could be completely overwhelmed. But Kansha, you at one point in these 5 days when you were in that isolated room, you broke down. You were crying uncontrollably. Why?
And that's when I reached out to people because I think it was getting to me. On the 4th night, I stepped out to ask about my report and get some dinner for myself. And I had a routine where I knew I should only go out of my room when people are asleep. So 10:30, 11 at night, or 4 in the morning to use the bathroom, or 6 o'clock to go and get water for myself. And when I went down, I saw people standing there asking the people outside, the doctors or whoever they were, the staff, where are their reports? They've been there for 9 days. Oh. One person talked about having come for a swab and nobody had warned him that he would to be in quarantine, and it's his 7th day. He's got a small child and his wife back at home. No one to take care of them. He didn't have a mobile phone probably to get in touch with them, or probably his wife didn't have a phone that he could communicate. She must have probably thought he was dead. And that got to me. I came back to my room and I was like, what is going on? I don't want to spend another day here. I have to step out to get water. I have to step out to use the bathroom. But the longer I stay here, the longer I'm exposing myself. I've come back home, but I'm still not home. We have an empty apartment that this is where I'm going to stay for the next 14 days because I'm just scared I may have an infection. I think I should have been tested again before leaving and told to isolate, which I am doing right now.
So you were 12 days that you were doing isolation at home because you were under the lockdown with no symptoms. Then you had to go in for a check. Then you've been in an isolated ward for 5 days, and now you're back home and you're self-isolating again for another 14 days.
Yes.
You have a child, you have a family, and you're staying apart from them completely alone now for another 14 days. Okay.
Yes.
And when you were in this isolated ward, you used to skip a meal because you just wanted as little exposure to the other patients in the mess.
Little exposure to the other patients. Yes, completely right. I didn't want to step out. On the 2nd day and the 3rd day, I had a friend who came over and dropped some dry food for me, home food for me, and I kind of survived on that. And yes, twice at night, I was very hungry, so I went down at 10:30, 11 at night and got myself some food. In terms of food, yes, there was food always available, They don't tell you what all you can ask for and not ask for. I didn't see anyone using hand sanitizers. My friend had given me hand sanitizer, so I went there and said, please refill it, and they would.
But there was no way of knowing, so it's all hit or miss, you're saying. Okay,
yes,
so,
I insisted,
the fact when you broke down, what comes to my mind is that people undergoing this, whether positive or suspected, are going through a lot. So we should be supportive. That's the one thought that comes to my mind, because we're getting reports of people in our neighborhood who may be corona positive, and one needs to just be more supportive of everything that they're going through right now, because it's a very hard time for anyone who either is suspected or their family members. What would you say the lessons are from this? Why should we highlight your story? What would you tell any of our viewers who are watching who may be showing some symptoms right now? What should they do?
don't be afraid to get tested. You know, if it's a protocol that you have to be in quarantine, but there are also facilities, paid facilities available at very discounted rates where you can check in, and if you can afford it,
No, but then
do
why
it.
didn't
So
you do
don't,
that?
because I wasn't aware of this. I was aware of this only on day 3, and I did request for the same, but I was told that if you're a suspect, air conditioning is not good. So I don't know for whom this paid quarantine facility is actually for, but I think just to be aware of all the things that are possible, maybe insurance covers this. I don't know. Someone needs to call up an insurance company and say, if we take a paid facility, would insurance cover this?
Okay. Do we have Prateek?
Yeah.
Prateek, similarly to you, what lessons would you say one needs to learn from this? Because in your case, you tried to get tested at a private hospital, and since then, the Supreme Court has said that private testing labs and companies should do this for free. Your views on that?
My views on this is, I totally agree with the lady that aggressive testing is required, and like reporting should be like within 24 hours. The lab should run 24/7. I went for private lab testing for my second test. The answer I got from these labs is the Supreme Court has ordered for free testing. We will give you a free test, but how can we ensure that the government is going to pay us? One of the replies. Second, that if you have to get tested, then you go to a doctor and get it written that you will get a test. Then only they will test you. You cannot just, if you are having cough and go to, let's say, SRL or Lalpak and ask them ki mere ko test kar dijiye. They won't do it.
But you would be willing to pay for this test?
I was very willing to pay for the test.
You don't want this private lab to do it for free?
But
my question is, Prateek, you're of a certain economic background where you don't need this price to be waived. There are people who are more needy than you who require it more, correct?
Exactly.
Okay. Akansha, a quick question to you. You were also told that you need to get a prescription from your doctor to get this test. How did that work out for you?
No, I didn't. But in the past, when we've looked up the possibility of ever getting a test done, I have seen that the doctor, they do ask for a doctor's prescription. And I had spoken to my ENT when I was being checked for my allergies, and I said, if I have to get a test done, would you give a prescription? He said, when you don't show a symptom, why should I? So the doctors will not give you a prescription till you don't show a symptom, and thus you cannot get a private test done. I am willing to pay for it.
Okay,
But
so a catch-22 situation for patients often when you're caught in this situation. Prateek, so I was asking Akansha, what lessons can one learn from this? What would you like to tell our viewers if somebody is like you and Akansha, well, like you really, showing symptoms, and what should they do next? What would you advise them?
The first and the foremost thing, if you even get a seasonal cough, don't take it lightly. It's a very sensitive issue. Please isolate yourselves. Don't get in touch with anybody. Call the helpline service, Government of India helpline service. They are responsive. I will be honest, 1075. They are responsive, but their responses are related to that if you need an assistance right now or if you want a test right now, they will just guide you through that. And if you want to get an ambulance at that point of time, you call 1075. They will also tell you that you call 102. So please get yourself tested, isolate yourselves. Don't take it like very loosely. It's very sensitive. It's very contagious. It is staying, as per my research, it stays on metal surfaces and walls for days. So always keep a handkerchief or a tissue, something handy, so that you can use it.
And Akansha, Prateek was out of breath. He felt like he was battling for his life, so he had to get to a hospital. In your case, if someone is in your situation, what would you advise them? Quickly, please, 30 seconds.
I would tell them that get privately tested, and once the report comes, report to the authorities. And if you have been in touch with anyone, please report to the authorities. It's important that we control the spread of this disease.
All right. Prateek and Akansha, thank you. Thank you for coming out and speaking with us on national TV, for being open about your stories and what happened with you both. And all the best. You still have many more days of self-quarantine and isolation. And all the best for you and your families. Thank you again for joining us tonight with your coronavirus story. Thank you.